Hello everyone, I'm your host Zishan and today we are going to talk about thyroid disease. So let's get started. Let's start with the definition very first. What does it mean? So thyroid disease is also known as a glycogen storage disease type 7 or phosphofructokinase deficiency disease. Let's write that down. It is a type 7 glycogen storage disorder disease which occurs due to PFK deficiency. Now there are two major aspects to it. The first one being muscle PFK deficiency, second one being erythrocyte PFK deficiency. And how does it happen and what it is? It is basically a rare inherited metabolic disorder that affects the glycogen metabolism. And also it is caused due to the deficiency of obviously phosphofructokinase. Now moving on to the next part. The biochemical basis. So on the biochemical basis, what does a phosphofructokinase do? So PFK catalyzes the reaction fructose 6 phosphate into fructose 1,6 bisphosphate. It is a critical step of glycolysis. Now also it commits the glucose to glycolysis. And also PFK is allosterically activated by AMP and also fructose 2,6 bisphosphate and inhibited by ATP and citrate. Now also deficiency in PFK, it is due to the mutation in PFKM gene which encodes the muscle isoform of PFK itself. Now it leads to the reduced or absence of PFK activity in the appropriate organ. Now this results in impaired glycolysis leading to accumulation of glycogen in muscle tissues and also an inability to generate sufficient ATP during anaerobic respiration, like in the case of exercise. Moving on to the next part, which is genetics. Under genetics, as we know, it is inherited recessively. What does that mean? At least both of your parents must be carrier for you to get this disease itself. Now also the gene location, the gene is located on chromosome. It is located on chromosome 12. Exact location is chromosome 12 Q13.11. Now what's special about it? Over 20 mutations in the PFKM gene has been identified so far in a patient with thyroid disease. Now this mutation can lead to reduced enzyme activity or complete loss of function. Now next feature, we have clinical features. So the very first being the muscle symptoms, the development of exercise intolerance. What this basically means, the patient experience muscle pain, cramps and weakness during physical activity, and these symptoms are due to the inability to generate ATP through glycolysis during anaerobic conditions. Also the second feature is myoglobinuria. What it is, it basically is breakdown of muscle tissues, which is also known as rhambolysis, which can lead to release of myoglobin into the urine, and it also causes dark urination. Now it also causes muscle weakness, and progressive muscle weakness may occur in some cases, not all. Now this third feature, clinical feature, is hemolytic anemia. Which is basically breakdown of RBC, and it leads to development of bilirubin in our body and also toxins in our body. Other symptoms may include fatigue, jaundice and enlarged spleen in severe cases. Now next part is Diagnosis. Under diagnosis, we have a combination of clinical evaluation, laboratory tests, and genetic testing to get a conclusion. So, under the laboratory test, the first one is elevated creatine kinase presence. Now, this indicates muscle damage. It is one of the enzymes present in the muscles. Second one being lactic acid, which is not present in the lactic acid rise is not seen after exercise, unlike in other metabolic myopathies. Third one is hemolytic anemia, which I talked about in the previous section. Second, if we do muscle biopsy, we'll find glycogen accumulation in it. And also absence of PFK activity, obviously. And to confirm these diagnoses, we do genetic testing. And identification and mutation in the PFKM gene confirms the diagnosis itself. Now, management, as we know, there is no cure to thyroid disease, but management focus basically on elevated symptoms and preserving complications. Like the very first being changing in lifestyle. What does that include? Avoiding any strenuous exercise and dietary adjustment like high protein diet. And because it provides alternative energy sources, and also avoid fasting and maintaining stable blood glucose levels. Second type of management is medical intervention. Medical intervention includes pain management, which is basically giving the patient NSAID. What is that? Non-steroidal anti-inflammatory drugs, which is used for muscle pain. And also monitoring for complications like hemolytic anemia and kidney functions due to myoglobinuria, and also experimental therapies which are still under development. And also because research is going on, the first one of this is gene therapy, and second one is enzyme replacement therapy. Now both of these are under research, and there may be a cure sooner or later for this disease. Now next section is about prognosis. Prognosis it varies from depending on the severity of the symptoms. Now most patients have a normal lifespan, but some of the patients may experience chronic muscle weakness and exercise intolerance to a greater extent. Generally, normal lifespan. Now, the last part is the differential diagnosis. Now, differentiating thyroid disease from other diseases. First one being the McArdle's disease, which is a glycogen storage disorder type 5. Second one being Pompe's disease, which is a glycogen storage disorder type 2 or disease. Third one being Cory's disease, which is a glycogen storage disorder or disease type 3. Now, how can we differentiate? McArdle's disease is deficiency of muscle glycogen phosphorylase. Pompe's disease is deficiency of acid alpha glucosidase, and also Cory's disease is deficiency of debranching enzyme. Now moving on to the final part, which is MCQ. The very first is, what is the primary enzyme deficiency in thyroid disease? The answer is very obvious: phosphofructokinase. Next, which of the following is hallmark symptom of thyroid disease? The answer is B, exercise intolerance and muscle cramps. Third question, what inheritance pattern is associated with Thyroid disease? The answer is autosomal recessive. Remember that, recessive. Next question is, which gene mutation is responsible for Thyroid disease? The PFKM gene. And the last question, which laboratory finding is characteristic of Thyroid disease? It is B, negligible rise in lactic acid after exercise. And that's it. Thank you very much.